Welcome to today's NEHA webinar on de-escalation and conflict resolution for environmental and public health professionals. I'm Christy Denbrock, Chief Learning Officer. Environmental and public health professionals have faced unprecedented challenges, not just in protecting community health, but in navigating increasingly hostile interactions with the very communities they serve. The alarming rise in harassment and threats against public health officials have created a crisis that extends far beyond individual safety, threatening the integrity of our entire public health infrastructure. Today, we're joined by Alicia Love, Bureau Chief for Meat, Milk, and Egg Inspection at the Montana Department of Livestock. With her Master of Public Health from Grand Canyon University and extensive regulatory experience in food safety, Alicia brings both academic expertise and real-life experience to this critical conversation. As a registered sanitarian in Montana and Arizona, she understands firsthand the delicate balance between enforcing regulations and maintaining essential professional relationships to protecting public health. Alicia will equip you with evidence-based strategies for self-regulation, situational awareness, and communication techniques that can transform potential conflicts into opportunities for building trust and achieving compliance. Let's begin this essential training that could quite literally be the difference between a productive partnership and a dangerous confrontation in your daily work. We ask that you please write your questions into the chat box and we will address them at the end of her presentation. If you are not a NEHA member and enjoy this session, we invite you to become one at neha.org. Alicia?
Wonderful. Thank you so much, Christy, for that welcome here. And I'm very excited to be sharing this training with everyone. This is a training that I developed for my staff here in Montana. This is training that was developed after, unfortunately, some less than ideal situations dealing with industry. And we found that it is a training that can be beneficial across a variety of professions and situations. And I hope that you will find it beneficial as well. Thank you again, everyone, for joining me. As public health officials, the contentious nature of our jobs became front and center during the pandemic. These headlines are likely familiar to many of you, and like me, and during this time, you probably thought, we're talking about science, we're not talking about politics or beliefs. These are proven facts. But even with a pandemic that has been declared over, we have not seen a change in our relationships within our industries and with the public. Since 2017, nearly half of public health officials have left their jobs. Many professionals stated that they experienced at least one symptom of PTSD, and the relationship between them and the public was part of the reason for their departure from this. We are now seeing a society that looks at public health differently. We're seeing colleagues that are leaving the profession, and we are seeing that recruitment is becoming a major issue in these realms. So what are we to do? We learn skills to adapt. We prepare new hires to address conflict, and we make sure that we are prepared for these situations so that we are able to protect public health, meet our goals, and stay safe on the job. So when someone says the word conflict, what word usually comes to mind? Fighting, anger, disagreement, argument, danger even at times. But conflict is inevitable. It's part of our lives at home, at work, even while out recreating. But the conflict being productive relies on the goals of the people involved and whether or not an outcome can be sought. The nature of our jobs as regulators and public health officials absolutely creates conflict. We have to find ways to uphold the laws that we're tasked with, and we have to find solutions to find that balance so that industries and individuals can meet their needs, their wants, and their capabilities. Everyone here, I'm sure, has heard about the fight or flight response. We've heard the phrase, we've all experienced it. This term was coined in the 1920s by W.B. Cannon as a way of describing what happens when we are faced with threats, perceived or real. These responses are both learned and innate, and they are meant to help us survive when we are facing a threat. Now, this was quite useful in more primitive times. In actual life or death situations, being prepared to fight or run from a threat was very helpful. Unfortunately, our bodies have not relearned when we are in real danger or not. So now, this response often kicks in when we don't need these assistances from our hormones and from our subconscious. And unfortunately, these responses can work against us. When these hormones are triggered and your body goes into fight mode, things happen that don't help you. You are in a survival mode that is not working with somebody, it's working against a perceived threat. You're arguing without a goal of solving the conflict. Your heart is racing. You might be sweaty. You can be nauseous at times. And in some situations, you may hear something that sounds like a very extreme solution. I quit my job. We'll get divorced. And this type of response doesn't help us solve the problem. In rare cases, someone may actually resort to physical violence. Unfortunately, the flight response is equally unhelpful for different reasons. You avoid the situation with no intention of solving it. You might gossip about it or maybe talk about it at home, but the conflict still exists even if you're ignoring it with the other person. And that does long-term damage to the relationship that you're working within. Another response that is possible is something called tonic immobility, or the freeze response. This response does behave a little bit differently than the other two. Your heart rate will actually decrease, and studies in 2015 and 17 found that this might be your body trying to buy some extra time to figure out what kind of situation you're in. The real world example of this would be fainting in a very intense situation. Again, this is different, but also not helpful. Thankfully, there are some tools that can help us manage these responses. The first tool is emotional intelligence. Emotional intelligence is the ability to perceive, control, and evaluate your emotions. This first box here is describing and identifying your emotions. When you start to get that pumping heart, sweaty palm feeling, can you put a label to it? I'm scared right now. I'm angry right now. It's knowing what is going on internally and having a plan to react to it. This also involves you knowing how your output impacts other people. If you start crying, how is the other person likely to respond? If you did something a little more aggressive, like punch a wall, you're likely to have an impact on the other person near you. The next part is self-regulation. Are you able to modulate your emotions in a way that is considered conventionally acceptable? Are you able to do things like avoid verbal attacks? Are you able to make decisions that don't compromise your values or are rushed and short-sighted because of how you're feeling in the moment? Next is motivation. You're able to work towards goals and when you identify that perhaps your emotional responses aren't appropriate, you work towards improving them. And last are your social skills. Empathy is a critical component to emotional intelligence. Can you see someone else's perspective? Can you understand how it might impact them? This can include even things like, are you able to recognize others for their efforts and see that they are trying to work with you towards an end goal? Now, when I talk about emotional intelligence, people often equate this with being a people pleaser, a yes person, and that couldn't be farther from the truth. Emotionally intelligent people are transparent. They're able to work towards a goal with you without compromising their values or their needs. So this could be something like, hey, John, I really need to take off early on Friday because my kid has a soccer game. Are you able to stay late and man the phones? And John might say, hey, Alicia, I'm so sorry, but I also have family obligations that day. I wish you the best. If your kid's soccer game is the following Friday, I would be able to help you out. So they're transparently saying what their needs are. They're trying to find alternative solutions, but they're not just compromising their values and their needs in light of yours. Generally speaking, emotionally intelligent people are the people that you like. They don't hold a grudge. They're transparent. You never wonder where you stand with them because you guys are talking about it and you know where you're at. Emotional intelligence is critical when you couple it with the understanding of what you can and cannot control. Especially these days, there's so many things that we're worrying about. So let's start with the circle of no concern. As you can see, the circle of no concern is things that we simply cannot control. I can worry about the weather, but my worrying won't change whether or not it snows tomorrow. I don't have control over the flow of traffic. Some things like the media or a sports match. These are things that bother us, but we really can't control them. All we can do is prepare and adapt for what is going on. Circle of influence is where, again, you don't have direct control over what is going on, but your decision making can influence it. And the best example that I have is trying to make a new friend. Perhaps I am at the office and there's someone else in my office that I've decided I really want to be friends with. And I might go up to them and say, hey, how was your weekend? Or, hey, did you see that Hamilton is in the theaters again? What do you think about that? Would you want to go see a movie? And the person is going to respond one of two ways. They're going to say, yes, I want to have this conversation with Alicia, and maybe I would consider going and seeing a movie with her. Or they're going to say, absolutely not. Alicia's not my cup of tea. I don't know why she talks to me. I'm definitely not going to go see a 3-hour-long movie with her. So we can influence it, but it's not within our control. So what does that leave for us? Our actual circle of influence. That's our actions, our work ethic, our choices, and the words that we say to others, right? So it's always important to remember that what we worry about and what we can control are not always the same things. All right, so let's get back to this confrontational situation. Oftentimes, we don't immediately recognize that there's a threat before us or a perceived threat before us. We start with that uncomfortable gut feeling. Some people will say it's like kind of the rocks in the stomach or the heavy stomach. Maybe you're nauseous. Maybe you're starting to feel your heart racing or your palms are sweaty. You can thank all of these unfortunate feelings to your amygdala. The amygdala is a subconscious region in the brain that is scanning the noise in your environment and looking for things that could cause you harm. So when I give this presentation in person, an example I would give is, oh, I just saw someone reach into their pocket. Why are they reaching into their pocket? Oh, they're checking their phone because their phone was vibrating, and that's not actually something that I need to worry about. So the amygdala is all that background noise happening there. Now, if the amygdala triggers something that it does think is a threat, it is going to send off a flood of hormones going throughout your body, trying to prepare you to fight or to run. Once this happens, it's kind of game over for the thinking side of the brain. Everything is just coming down to really, really basic survival. And unfortunately, that doesn't help us think critically. So, you've got the gut feeling, you've got the sweaty palms, the heart is racing, and you're not quite sure what's going on. You want to look at the person that you're engaging with. Is there a sudden change in their body language? In my case, I tend to be a pretty expressive person when I'm in person. I talk a lot with my arms, I move around a lot. So if I suddenly were to cross my arms and perhaps not make eye contact with you anymore, that's a pretty good, strong sign that something has happened here. It could be something really direct, like clenching fists. And of course, if they start yelling or threatening or anything like that, of course you have a conflict. You know that at that point. So, you've identified there's a conflict. The person you're engaged with has given you some either subtle or very obvious clues that they're not happy at this point. You need to evaluate yourself. How are you communicating right now? It's quite often that when people start raising their voice, it's very common for us to even subconsciously try to match that level. Have they started yelling and now you're yelling and you haven't realized it? How are you speaking? Are you saying a lot of, well, you, or are you staying calm and staying focused with that I-centered language? I feel that this is getting a little bit heated. I understand that this is getting frustrating. What is your body language like? Are you subconsciously showing that you're upset as well? Are you crossing your arms? How close are you to this person? Are you kind of right next to them, or do you guys have some room between each other? And finally, how is your breathing? Do you feel like your heart is racing? Do you feel like maybe you can't breathe? So if that is going on, it's time to pay attention to what is happening. Emotional dysregulation is something that is very easy to identify in other people. It's not always something that we recognize when it's happening. Let's watch this example.
Nina said as long as I was escaping, would I mind escaping to the market and picking up something for dinner? Sure, that was all I needed. A busy supermarket. I needed to drive, mellow out, get my mind off the wedding. But mellowing out was not in the cards.
Here we go. Yeah.
Well, I got a real nice bed of land here.
Excuse me, sir. What are you doing?
I'll tell you what I'm doing. I want to buy 8 hot dogs and 8 hot dog buns to go with them. But no one sells 8 hot dog buns. They only sell 12 hot dog buns. So I end up paying for 4 buns I don't need. So I am removing the superfluous buns.
I'm sorry, sir, but you're gonna have to pay for all 12 buns. They're not marked individually.
Yeah. You want to know why? Because some big shot over at the Wiener Company got together with some big shot over at the Bun Company and decided to rip off the American public. Because they think the American public is a bunch of trusting nitwits who'll pay for things they don't need rather than make us stink. Well, they're not ripping off this nitwit anymore because I'm not paying for one more thing I don't need. George Banks is saying no.
Who's George Banks?
Me! Why don't we just calm down now, sir? I'll tell you why we don't calm down. Because you're not excited. It takes 2 people for a we to calm down, doesn't it?
That I don't know, sir. I'm just the assistant manager of a supermarket. But I'll tell you this, if you don't pipe down and pay for those buns, I'm going to call the police.
Oh, right. Yeah, yeah, right. That's right. Hey, right. Hey, come here. Come here. Come here. That was the low point. Flipping out over 4 hot dog buns.
All right. So in that situation, it took a little trip to jail to calm down and George Banks to say, you know what? I don't think maybe that was the right way to handle that situation. So your heart is racing and you're trying to make sure that you are not about to flip out over some hot dog buns. The first step is to remove yourself. This can sound like, I feel like this conversation's becoming unproductive. Can we take a break? If you don't feel comfortable saying that, and sometimes we don't, it's okay. Oh, that's gonna try and go ahead of me. Sorry, folks. So if you feel like you can't have that conversation and be transparent that you're starting to feel upset, tell the white lie. Hey, I just noticed that my boss said I need to text them. I'm gonna step out and take a break for a moment. That's okay too. We're not avoiding the situation forever. We're taking a step away. Once you've done that, it's really important to see kind of where you're at in your fight or flight mode. If you feel like your heart is racing, if you're having that response, I would recommend this breathing exercise that I have used effectively for several years now. Very simple to keep track of. You're going to take that really big deep breath in. You're going to hold it and count to 3. You're going to count to 3 as you go out. You're going to hold it for 3 out and then start the process over again. While that counting is happening, all you want to focus on is the counting, and it takes some practice to do this. I would strongly recommend that people practice this in low stakes situations where maybe there's not a lot going on, and really kind of training your brain to do that counting and to kind of let the outside noise go away for a little while. This helps kind of reset your nervous system. It helps those hormones kind of go to their respective places and lets everything kind of situate for just a moment. Once you're there and you feel calm again, you want to reflect on the situation with neutrality, a very simple statement of the facts. So in the case of poor Mr. Banks and his conflict with the clerk, Mr. Banks wanted to buy an equal number of hot dogs and hot dog buns. The clerk would not allow him to try to purchase buns in a way that they were not meant to be purchased. There's obviously some other opinions about that situation, but that's the real facts, right? Oftentimes as regulators, we know what triggered our conflict. Hey, they just found out that they are going to get a violation today. You just told someone that their poodle that won't stop trying to bite everyone isn't allowed to be in the coffee house. We oftentimes know in these work settings what is causing the event to happen. But it's important for you to also reflect on how you're feeling about it. Am I angry? Am I scared? Am I upset? If you've got some kind of emotional stakes in the game, it's important to acknowledge that, right? And then you want to think about some possible solutions to what's happening right now. All right, you're calm, you've got a game plan, you're ready to solve this conflict. You want to start off by asking the other party if they are ready to talk about this. Now, I always tell people when I give this training, most other people don't have conflict de-escalation training. Most other people have not taken that time away from you to breathe, to focus, and to come back with the solution. That's probably going to be uncommon. So you're a little bit ahead of the conversation at this point. So if they say, nope, I'm not ready to talk to you yet, you say, okay, no problem. I'm going to go check some emails. Can I touch base with you in a little while? Could I come visit tomorrow? So you want to make sure that we're not just allowing the avoidance to happen. We need to get to the end of this conversation, right? Once they say yes, they're ready to talk. Look at your surroundings. You want to make sure that you're not picking a very crowded place that has a lot of audience members, because that's going to put the other body on edge. They're going to feel nervous or maybe even embarrassed, especially if they're a manager and they have staff around, right? It's embarrassing to have these types of conversations in a very public setting. You want to be mindful of anything in the room that could be potentially harmful to you. As Christy said at the beginning of this conversation, I am a supervisor of meat inspectors. We're in meat plants with firearms, knives, huge saws. The room that has the weapons in it is not the one to do a conflict de-escalation in. Let's find the office. Let's find the other places that are safer for everyone. You also want to make sure that you are not physically blocking the door, because that is going to trigger their amygdala and tell them that they are trapped. Even if that's not your intention, even if that's not what you're trying to do, it will not allow them to feel at ease to talk to you about the situation. So you want to avoid that. If they are standing, you stand with them. If they are sitting, you should sit as well. Sitting is preferred. That's considered to be a little bit more of a calming effect than standing is generally. And you want to make sure that your body language isn't setting off any cues that you're unhappy with them. So crossing your arms, tapping your feet, rolling your eyes, lots of really negative body language that cannot help the situation through. It's okay to let them vent. I always tell people that I'm okay with people venting as long as it's not abusive. Oftentimes in the work that I do, when I'm taking an enforcement action, it's going to have an impact on a business, and that's stressful. And they may want to verbalize that. So letting them talk through all of it can be really, really helpful. Letting them get all those thoughts out, because if there's so much going on up here, they're not hearing what's happening over here. So let them vent, let them get through it. And as they're venting, you can pick up information that might be helpful. You can pick up things that are like, hey, that's something that agrees with my solution. That's something that agrees with my outcome. And you can grab that and say, hey, I heard you say you really want to do this. I agree with that. I think that's really, really important right now. So that way you're prepared to look at this as a joint solution. Once they're done venting, ask what they're thinking for a solution. Try to be mindful of it, consider it fully. If it's not a solution that is workable, see if you can pick up a piece of it to build it into your suggestions. They also might tell you that they need time to think about it, or they need to do some research, and that's okay too. Say, okay, I'm hearing you say that you need to make some phone calls. Could I touch base with you in 2 days about this and see what you learned? That way, you're looking at it from a same side approach. You're both trying to solve the problem together. All right. With any training, there's always some limitations. If you are not safe, you do not try to de-escalate this. If they are threatening you, you do not try to de-escalate this. And sometimes you can attempt de-escalation and the person simply will not respond to it. Every time you say something, they just go right back to kind of being at that top level where it's very, very just unproductive. So don't feel like every single source of conflict requires you to de-escalate. Sometimes it simply isn't possible. All right. As I said at the beginning of this presentation, most people who work in public health have experienced at least one symptom of PTSD. It is critical to treat these interactions as an injury. That can mean doing things like taking a break. If you are a supervisor of staff, I would strongly encourage you to treat it as much as someone maybe getting cut on the hand. They need to do aftercare. If you're the person that is just coming out of the situation, there's things you can do. Calling someone that you trust and saying, hey, I just had this crazy thing happen and I just need someone to talk through it with me. I just need you to hear what happened. Taking a walk outside can be very helpful. If you're someone who meditates, that can be helpful. And research has even shown that doing something like eating a small snack can help your body feel safe, because we don't sit and eat when we're not safe. So there's lots of things you can do to kind of help reset your body, reset your stress level, and kind of get back to that right place. Something else that I also strongly encourage people to be aware of are, what are your mental health benefits where you work, or do you have access to mental health benefits another way? You may not need prolonged therapy after an event like this, but even one session of saying, this happened to me and I'm really bothered by it and I need to work through it. Because if it's not treated, then it's a wound that doesn't heal. So it needs to be taken very, very seriously. All right. If you are a program manager or a human resources person, I encourage you to develop a policy on staff safety if you don't already have one. If you are an employee and you are not aware of what your safety policy is, ask. Make sure you know what it is and who you need to reach out to when these things happen. You want to make sure that you're prepared. I mean, we always hope that these things aren't going to happen, but you need to know what the steps are if it does. So in Montana, for my bureau, my rule is get to safety as close or as far as required. If going to your car is far enough, great. If you have to go to your car and drive down the road, that's okay too. Safety is the most important piece of this. Don't engage in the altercation. Call the police if you think that is necessary, and then notify your immediate supervisor of what has happened. You want to write this down because our memories are not as rock solid as we think they are. So you want to write down, hey, at 12:51, this happened and I was here and this employee said this. Get all of that while it is fresh. Within the regulations that I have, we are actually able to close establishments for this type of behavior, not permanently, but temporarily. So you want to make sure someone knows something happened. You need to reach out to somebody and make sure that you're sure of what happened. All right. So it is critical that you don't give these trainings after something happens. This presentation is something that I do as part of onboarding. It's part of my hiring process, and my group does refresher trainings on this periodically. I think it's really important to remember that a lot of the skills and the expertise that we have, it's a muscle. We use it all the time. We're doing it every day. This is not something that we use every day, so it needs to be kind of reminded to staff on a routine basis so that when these things happen, they're like, oh yeah, 2 years ago we talked about this. What was I supposed to do again? Again, as a manager, you need to have a reporting protocol, and that needs to include close calls. Oftentimes, when I have an incident happen, the employee will say something like, yeah, I have problems with this guy all the time. He yells at me constantly. He does this constantly. And it's frustrating as a manager because these things escalate. And maybe the really big event could have been prevented if we'd gotten involved when it was just someone yelling or being inappropriate. So integrate it into your training with staff. If you're someone that might receive reporting of these things, take them seriously. A lot of research has been put out about hostile work environments, especially in nursing fields, and the research overwhelmingly shows that people will not report things if they don't think anything will happen. So don't manifest it. If someone says, hey, something weird happened today and I'm not feeling comfortable about this, and you say, yeah, but it wasn't that big of a deal, and you move on, they won't report it again. And then all of a sudden you have a really big situation that had a lot of warning signs kind of sprinkled along the way. Take it seriously. Make sure your staff know you are taking it seriously. You should also be working with program managers and, again, human resources on what your options are. In my organization, if we have something that isn't going to be closure of a plant, but is maybe a close call, we can send a warning letter to the establishment and say, hey, on this day, you engaged in this. That's not okay. And in the future, we aren't going to tolerate something like this. So know what your options are. Can you issue a fine? Can you discontinue services? Know what your action plan is so when the event happens, you know what tools are in your toolkit to respond to it. Finally, remember that you should have your staff report suspicious behavior. This can be, hey, we work in a really small office. There was a person just kind of hanging around, asking kind of weird questions. I don't know what they're doing. So, does it mean someone's in danger? Maybe not. Maybe it's nothing. But don't just write off these odd situations as nothing. You want to make safety a priority within your organization, and you should have staff that are sensitive to what's going on around them. If you treat things as not big deal, your staff will respond in kind. And that allows things to manifest that maybe could have been dealt with earlier on. All right. So I've got a couple of exercises that we're going to do. I'm going to have people just kind of put their thoughts in the chat about each scenario, but here's kind of a summary. It's really, really important to remember that even when people are being disrespectful and unprofessional to you, that you must hold that higher bar. It's unfair. In some situations, it's not reasonable, but I always remind people that we're going to get judged more harshly than the public will. So be prepared for it. And again, if you feel like there's something going on and you can feel like you're going to say something that's maybe not going to go well, it's time to step away. Conflict is normal. There's so many things that are conflicts every single day that you would never register as a conflict because it was productive, it was professional, and it had an outcome that was satisfactory for everybody. No in a conflict is not productive, and no in de-escalation is not going to be the safest choice for you. Remember to stay calm through the process. And then remember that not all these steps might be needed. Sometimes there is no follow-up. Sometimes you can skip through to the end. All right, let's put some of this new knowledge to the test. I'm going to keep each slide up for a couple of minutes. Once you've kind of thought through it, feel free to drop your thoughts into the chat and we'll see how it goes. All right. Your coworker calls you and says they feel that you're not doing your work correctly. As things progress, they're talking louder and faster, and they're talking over you. What do you think? All right. I think everyone's pretty confident that we're escalating. What next steps do you want to take? Just kind of reading through. Take a break, for sure. Absolutely. All right. I'm going to kind of summarize this. I love all of this interaction. This is fantastic. So I've seen offer to talk about it later. I think that's a great idea. Scheduling a coffee break with them so you can meet them in person. I love that idea. That's great. In some cases, maybe it's time to reach out to a mutual supervisor and say, hey, is this kind of the right way to go about this? You want to make sure, right, that you're not being defensive, you're not being accusatory of what's happening, and maybe be a little bit curious about it. Hey, why do you think that? What's making you say that? and do some really good active listening on it. And maybe there's something in there that's valid and maybe there isn't. So, yes, ask them to facilitate the conversation. I like that too. So, tons of ways that we can work through a situation like this. But I think you guys got it. Excellent work. Okay, let's do another one. All right. Again, I'm kind of a food-centered person, so for the non-food people in the room, I apologize, but this is my wheelhouse. You go to a plant for an inspection, you see someone picking up a knife that was dropped on the floor, and they're going to resume using it. You let the owner know, and they start yelling that you're lying and you're out to get them. If I had the option to do a poll right now, all of my environmental health people would probably say, yeah, they've been accused that you're out to get them, right? So, and always an important distinction here. The person you're talking to is not the person with the knife. You're talking to the manager that manages the person cutting stuff up. All right, so what do we do? Maybe there's video footage that could be looked at. Maybe having a picture that you can take. Remove yourself from the area to talk about it. Love that. How do you folks usually handle when someone says you're lying about something? How do you handle that generally? Go to a safe distance and document. What reason do I have to lie? I like that. This can be kind of an iffy one, but maybe just asking the employee and saying, hey, did this happen? And I mean, again, you're taking a little bit of leap of faith with them, but hoping, right? Okay. Melody, I like your steps there. That looks solid. I like that one too. Remind them that we're here to protect public health. We have the same goal, right? That's a really big one that I like to lean on a lot when things start to feel a little bit heated. I know you, business owner, wants to have a safe product. I know you want to have a high quality product. Jerky's pretty big in Montana. We've got a lot of jerky plants. I know you want to have the very best jerky there is out there, and you would definitely not want anything on the floor in your jerky. I know. So lots and lots of great options that I'm seeing in the chat here. This looks good. I like this. And I want to acknowledge the people here too. Like if it feels like they're yelling a lot and it's really not going in the right direction, definitely leave, right? Step out and talk to the supervisor. For sure. Absolutely. Yes. This is all looking great. Okay, let's try another one. Again, I'm a food-centered person, so you're all just gonna have to bear with me on this, but I think you guys are nailing it. You observe that a deli slicer isn't clean during an inspection. You let the manager know. He rolls his eyes and walks away, but then someone comes over and starts cleaning it. A little while later, you see an employee not wash their hands the right way. You go let the manager know again, and he gives you a little bit of sass there. Says, are you done talking to me about this? And you say yes, and then he leaves again. Are we escalating right now? What do you think? Yep. So how do you all think this would go if you found a third issue? Where do you think we're headed? Okay. It could escalate. Absolutely. So, absolutely. You guys are getting this. Sorry, I'm having a hard time talking and reading at the same time. So, some of the things that I'm seeing in chat are saying maybe talking to staff directly. I always like when this comment comes up because you can approach the manager at the end of this and say, hey, I noticed there was some frustration when I came to find you with these issues earlier today. Is there a different way you want me to bring this to your attention, or is there a different person that you would like me to bring this up with? Some people want you to talk to their staff directly. Sometimes they want to be involved, right? Another thing that I always want to remind people is that humans are inherently egotistical and it's not our fault. What if this guy's just having a really bad day and he doesn't even realize that he's taking it out on you? Maybe he just hired a bunch of new staff and it's pretty darn obvious that they don't know what they're supposed to be doing and he's more mad at them than you. It doesn't mean that it's your problem and it doesn't mean that you should be the emotional punching bag here. But sometimes just calling people out and saying, hey, I noticed that our interaction today was less than ideal. What's going on? Yep, inviting the manager to finish the inspection with you. That's a solid choice as well. And praise the good. Eddie, I always like that one, right? If you can find something awesome or you notice that they fixed something from your last visit, call them out on it. Like that really, really helps kind of bridge it, right? I always tell people when I walk into a plant and I see them, like, hey, I know you're probably not excited that I'm here visiting you today, but we've got the same goals. The compliment sandwich, you've got it. I can't say I always try and finish the sandwich. I think sometimes I'm more of an open face sandwich, but try and find the good when you can. Okay, we've got one more scenario. Oh, Mr. Banks and those darn hot dog buns. What maybe could the clerk or the manager have done differently to diffuse that escalation? Empathy, absolutely. Agree with him. Deb, I always love this one. I want the same number of hot dogs and hot dog buns too. What would have happened if it would have been like, hey, isn't that crazy? I hate that. And hear him out. For those of you that have watched the movie, he's really freaked out about his daughter getting married and how expensive it is, and there's a lot going on there. And the hot dog buns were kind of the straw that broke the camel's back. So it sounds like there was some more stuff going on. Let's talk about that manager for a minute. What could that manager have done a little bit differently? Not immediately jumping to the police. Yes. Yeah. See if we can find a different vendor that sells the right number. I love that. For sure. My name is Bob, not I'm the assistant manager. Absolutely. I think I've got a crowd of de-escalation experts. Okay. Christy, I think we've got just a couple minutes left. If someone can kind of help me wade through some of the questions, I may not be able to get to all of them, but I can definitely try and tackle a few with our remaining time.
Yes, that's great. And thank you so much, Alicia. I've always liked the comment of sometimes people just want to be heard. And once you hear them out, that completely can de-escalate a situation. I have a question I would like to bring up first, Alicia, if you don't mind. Can you tell us what specific policies and or support system should public health agencies implement to better prepare and protect their staff? And we have so many staff members on this call. If their agency doesn't have a policy or support system, what would you suggest is their first step in getting one to protect their agency?
I think I'm a data person and just say, hey, here's some data on what is happening. It's not just our health department. It's not just our agency. This is something that is now becoming, unfortunately, a trend in this line of work, and it's important. You know, there was a picture of a headline at the beginning of the presentation that strongly recommends that de-escalation and safety policies be implemented in these type of working environments. So maybe starting with that, starting with human resources, right? I think it's really important for people to know that sometimes the conversation that happens with a direct manager may not always carry across to your human resources officer. So if you don't feel like you're getting somewhere with the manager, maybe going to human resources and saying, hey, I think it's really important that there's some safety stuff in place. And if nothing else, bringing it up as a burnout perspective. When people don't feel supported and they don't feel like they have a voice in their work environment, people leave. So I would hope that most agencies that are within this organization here, they want to take people seriously, and if they don't feel safe, they're heard. But I'm a big data person, so those are my suggestions.
Okay, another question is, given the current climate and the distrust toward government agencies, what are the most effective strategies for establishing credibility and trust with community members?
Absolutely. This is, I think, still a question that comes up constantly. Making sure that your staff are as consistent as they can be. Again, we're not going to see every situation twice, right? Like the knife example, one person might see that one day. You may not ever see that again. But knowing your regulations. And another thing that I think is really, really helpful is being prepared to do the deep dive. When they say, hey, I don't think that you're looking at this the right way, be open to that feedback and say, hey, let's look at the guidance documents. Let's look at the law. Is there, within the meat world, we have directives that tell us how to interpret laws. Let's pull up the directive and let's read it together. So be prepared to have the dialogue when someone questions your knowledge, and don't get upset about it. Say, hey, there's a lot of stuff rolling around up here. As I'm getting older, some of the screws are coming a little bit looser. Let's take a look and make sure I'm on the right base. Let's check it out. Let's make sure together. There's nothing that makes me more excited than a knowledgeable operator that says, hey, I interpret it this way. What do you think? Because now it's a dialogue. Now it's, I want to confirm my understanding with you. And I think this is hard for people, but admitting when you're wrong, saying, hey, I misunderstood that regulation. I apologize. It was a learning moment for me. Thank you for bringing this to my attention. A big one, I don't hear it as much anymore because I'm not in the field as much anymore, but so many people have said, well, you're just here to close down all the meat plants. And I say, well, that's not going to do me any good. I need a job, and if there's nothing to regulate, then they don't really need a head regulator, right? And I really, really try to push in that local processors are so important to me. I want to go to the farmer's market and buy an excellent steak. I don't want to buy a steak that was in a giant warehouse. I want to see what my local community is doing. And I want to be part of that microeconomy. And put your money where your mouth is.
That leads right into my next question for you. How do you maintain an ongoing professional relationship with individuals or businesses after a conflict has been resolved, particularly when enforcement actions were required? How do you mend that and keep that relationship going in a positive manner?
Calling out the good, right? So you're telling them they need to change it. They change it. Don't let there be radio silence there, right? You see them rebuild a wall that was damaged. You see them upgrade equipment that was really, really out there. Show that you see it happening. I was in one of my plants a couple months ago, and this particular plant owner actually won Small Business Owner of the Year. He got to go to DC. It was a big deal for him. I was aware of it, and I called it out and I said, hey, how was it getting that award? That was fantastic. That's so cool that you can represent this industry in such a cool way. He was so surprised that I was even aware of it, that I was even going to take some time to call it out. I know that this is sounding very buddy-buddy, very like, hey, let's all be friends. And that's not the goal. I'm not saying that. We have a job to do and a very important one. But anytime you can lead a conversation that's positive, it really can impact how the rest of the day goes.
Have you heard the conversation of the hamburger, where you start the conversation with the positive, the bun, then you put in the conflict and the meat, and then you end the conversation with the bun? Have you used that tactic? Does that work in this type of situation?
Sometimes I do. Sometimes it's not always possible, but I do try to find something that I can grab that is a positive. And like I said, if you're asking them to do stuff, make that note to check up on it and to call it out if it's fixed. It's if we just come in and are just like, nope, you did this wrong, this wrong, this wrong, this wrong, this wrong. And then they did make positive changes. It's like, well, she's not paying attention to that anyway, so who cares? They should care about it, right? They should. Kelsey, I like this question, so I'm gonna jump into this one. So if you're new, where the community did not have a positive relationship, how can you build trust and establish that relationship moving forward? What I would recommend is that you should always be asking questions, open-ended questions, not gotchas. Hey, can you tell me about this process? Can you tell me about, what your business model looks like? And finding that common ground. Yes, Amy, I love that. I think it's really important to find the human in these interactions. You see, they've got a sports jersey that's up on the wall, and it's a team that you follow and say, yeah, they're killing it this year. Oh man, it's rough being a fan right now, right? So trying to find those human elements to it. And again, stay honest. Don't try and like do the lie through it if you're not sure about it. People really, really, really respect when you say, I'm not sure about that. I'm going to find an answer and I'm going to get back to you, and then make sure you follow it through. If your bandwidth allows, just stopping in and saying, hey, not here to do an inspection today. Just touching base and seeing how business is going. How's your day? And then leave. Trying to do those small touches. I would always make a joke with my plants and say, hey, if you have a question about how to do something, just call me, because it's not a violation unless you do it and I see it. So, hey, Alicia, we want to micro tenderize our steaks with a whole bunch of cockroaches. What do you think about that? And I can say, hey, you can't do that, but let's talk through some other options. Let's see how else you can get there. So sometimes those kind of silly examples say, look, I'm not out to get you. I'm trying to help you. And it's so much easier to give you good information and help you set up for success than try to fix it on the back end. Let me save you time. Let me save you money. Let me find a good place that can find some resources. So those are all some ways that can kind of help build that human relationship that makes it easier when you have to share bad news.
Well, Alicia, as always, you're absolutely fabulous. We thank you so much for your time today and your presentation. It was just a wealth of information. And to everyone attending, your feedback is important to us, and we encourage you to fill out the short survey. It helps us to continue our mission to build, sustain, and empower an effective environmental workforce. We thank you for attending, and we wish you a good rest of your day.
Thank you, everyone.